Hello, everyone, and thank you for tuning in. Welcome to our first EchoStor Healthcare webinar. We're excited to kick things off today. My name is Matt Hoeg, CTO with EchoStor, and joining me today is Jamas LaFreniere, one of our enterprise account executives, who is really responsible for leading our healthcare practice, alongside one of our principal solutions engineers, Mike Hale. Jamas, why don't we start with you for a quick introduction of yourself and your background?
Thanks, Maddie. I'm excited to get this webinar series going. A little personal background. I joined EchoStor about 2 years ago after spending 17 or so years between EMC and Dell. And my entire 20-year career has really been focused on technology and healthcare and really helping customers solve problems with technology and provide better care with technology, which is really what it's all about in healthcare. I joined EchoStor really because of the rich history of a customer-first, deep relationship-driven culture and really some great healthcare customers already, some of which have been with EchoStor for almost 20 years, which is pretty incredible. So today, Mike is going to be the focus of today's chat, but I wanted to provide everybody with a little bit of context of EchoStor and healthcare and why we're doing this and why we've put such a focus on this. So first, this really is the first vertical within EchoStor, and that's based on several factors. One is, I mentioned it, we had a really strong base and network within healthcare, and we want to be trusted advisors to those customers. And I think having the ability to pool from different experiences and different customers really is a critical factor within healthcare and helping those customers network within that space. Another thing is many of our strategic vendors and partners have specific teams and go to market within healthcare. So I think it's critical that we also align to those. And it also allows us to vet certain technologies and solutions that are a better fit within healthcare for several factors. And also, I've spent 20 years in this space. I do think healthcare is unique. I think EchoStor understands that. The applications, some are the same, but many are different. And I think budgets and financial models are very different than in a traditional other sort of account like a bank or financial institution. And the challenges are certainly different. They truly, the healthcare customers, especially within IT, are truly asked to be doing a lot more with less. And I think it's critical that your partner does understand that and trusted advisor. And that's what we look to do. So I think those are the real factors and why we've really focused on that. And I think as we've sharpened our focus within healthcare over the last 2 years, as I've seen what our customers need and ask for, we've brought on the right resources. So you're going to hear from Mike Hale today. Mike is a great friend of mine. We go back many years, and he truly is a key player within the healthcare space and did some incredible things in his career. And he's helping our customers already, which has been great. And then I'm sure in a future webinar, you'll hear from Tanner Crow as well. So another great resource that we brought over from one of our healthcare customers that has incredible experience within the space. So as I mentioned, healthcare is a passion of mine. It's been something that I've cared about for a long time. It's a passion of Mike's, and it really is a passion of the entire team at EchoStor. And I think that is a big difference for our customers and prospects. Maddie, we're excited to get things going and hear from the star of the show today, Mike. So I'll turn it back over to you and get into some of these questions for Mike.
Absolutely. Thank you, Jamas. It's so fantastic to have you here. So, Mike, I know you've been in healthcare for a long time in various capacities. Can you give us a little bit of background on yourself?
Yeah, so I've got over 25 years in experience in technology architecture, engineering, and support. I've worked in a variety of industries, banking, higher education, manufacturing, and real estate. But I've spent most of the past 18 years working in a few different areas of healthcare. In the acute care space, some long-term care, the rev cycle management, and coding and billing. The bulk of that time I spent at Steward Healthcare. I spent 12 years there. When I started, we were 6 hospitals located in the greater Boston area. And over my time there, we grew to 40 hospitals across 9 states nationwide and also several international locations. My roles increased as the company grew. I started as a solutions architect, served in a variety of director roles, senior director, executive director, with responsibilities for leading different areas of infrastructure and security, from data center, storage, systems, database teams. And that culminated with my last 2 or 3 years that spent there as serving as chief technology officer.
Wow, that's impressive, Mike. So tell me a little bit more about your experience specifically with Steward Healthcare. What were some of the key challenges that you faced through your tenure there?
Yeah, it was a challenging environment, very rewarding at the same time. The predecessor company to Steward was really underfunded. They were in tough financial shape. There's a lot of lack in investment in technology, and they were behind the times in many respects, even back then. For example, they had a single core data center. It was on-prem. It was loaded with single points of failure. It had limited and incomplete disaster recovery solutions, really no high availability to speak of. It also had a mix of legacy platforms. So we had a variety of different storage platforms. There was storage from different vendors, and some platforms, while they worked for the PaaS organization, they weren't positioned for the scalability needs and for growth that we were told to anticipate at Steward. We also had tons of rack mount servers. Again, they were a mix of brands and vintages. There's really little blade technology and really an inefficient use of our limited data center space. What we needed to do was modernize quickly and really build for scalability for what was positioned to be a growing company. There was a lot of increasing capacity demands as well. Like even in the early stages of Steward, as the new company was founded, it was built on this legacy technology foundations, and again, really tight on available capacity. We had a growing core data center. Again, when I joined, there was a data center renovation project that was in kind of the early stages. It was incomplete, and we really needed to get that project under control and fast forward expansion of our of our data center footprint. So that was a project I took over and oversaw through my first year. And then at the same time, we were being asked to perform a lot of integration and modernization of legacy platforms, things like email, basic services, email, file sharing, lots of old clinical and business applications running on old hardware. And all of that in the face of some significant financial challenges. And while financial funding was and budget varied from year to year, like lots of healthcare companies, we had a tough time recovering from things like financial impacts of the pandemic and changing reimbursement rates. Rising inflation took its toll on a lot of our ability to execute on projects. So we had to do everything with some cost sensitivity in mind. And that kind of brings us to the financial challenges that healthcare leaders still face today. They're being constantly looked at IT spend, thinking about hybrid cloud or cloud spend, forecasting and managing and controlling those costs. All that in the face of ongoing demands and growing demands for things like data, the ever-present risks for protecting that data from cyber threats, advancing emerging technologies like AI to improve caregiver and provider efficiency, and basically constantly looking to improve the overall patient care experience. So I think IT leaders need to deliver these services and determining how to deliver them in the most cost-efficient and robust ways to provide these solutions. And that's where the team of rock stars we have at EchoStor can really help.
Absolutely.
Yeah. And there's all that you're trying to do that in direct conflict to the increasing service demands, thinking about things like access to care, making both the patient and provider experiences better and providing easier and faster access to data that can lead to better outcomes and the success of our healthcare customers.
Yeah. When you talk about some of the financial challenges that you mentioned and having to navigate technical debt and ensuring alignment with regulatory compliance, it's not necessarily unique to healthcare. When you couple all of those challenges with the fast-paced, high-pressure atmosphere of a hospital where lives are on the line, it definitely increases the criticality. So as you look back, what do you think were some of the biggest hurdles as you were working toward resolving some of these challenges? Was it people, process, technology? And also, how were you able to overcome these hurdles?
Yeah, at Steward, it was really a combination of all three. We had really some solid members in the technology organization when I started. These were loyal and dedicated employees, but at the same time, they were overworked and we knew we didn't have all of the talent to fill all the roles we needed and the numbers of resources we needed. So as we started growing and we started enhancing the team, it became apparent that we probably weren't going to be able to do it alone. And we knew we had to work with some strong and trustworthy technology partners. Same time, we also established solid processes for delivering support and advancing our technical capabilities. As our technology was refreshed and changed, we modernized our processes along the way. And we continued that even as the environment got more and more complex and we integrated systems as we grew through a significant number of acquisitions. And as I mentioned before, we expended a ton of effort evolving our core infrastructure platforms. We did that with an emphasis on reliability, security, and scalability. And that's really where it was beneficial to have a great technology partner and to help develop and deploy solutions that were rock solid from day one and provided the highest level of services, reliably, scalably, and securely to our growing healthcare user environment.
Yeah, and obviously, so technology has been advancing substantially over the last several years. So what are some of the new challenges that healthcare organizations are facing with the new technology climate?
Of course, there's AI, right? It's all the rage these days, and the challenge is how do healthcare organizations get in front of it? It's a learning curve for everyone, including the users, and you're just trying to figure out how to leverage those AI services, how to curate good prompts and responses, being able to enter the request to get complete and accurate responses the first time in order to maximize efficiency gains. And administrators and people that manage those systems need to really identify and address risks, how to thinking about minimizing and eliminating things like hallucinations and preventing responding back with bad data. And of course, there's the security aspect, ensuring that the right data is accessible while improper data isn't. Another big challenge is I'll call the edge, right? There's this expansive technology that makes up the healthcare environments. And there's been advancements in things like patient home care and wearables, patients taking some control of their own health. Thinking about the changing physical topology of healthcare systems, where you've got to deal with ambulatory centers versus just hospitals. Now, this is a decentralized model. There's no more core and edge anymore. It's just one big ecosystem. And along with that, there's mobility of doctors, right? They're not always operating in a hospital setting. Sometimes they're in clinics. Sometimes they're working from home. Sometimes they're in remote offices. And providing access and technology services wherever those medical professionals are is a real challenge for healthcare organizations.
Absolutely. Yeah. So here with EchoStor, we've been collaborating with customers for the past 20 or so years with a variety of different business challenges that they may be facing and across a variety of different technologies. If you look at our portfolio, we've really segmented all of the different technologies that we work with into 6 key pillars. So we have next-gen data center, we have security, networking, digital workflows, modern workplace, and you mentioned artificial intelligence. We have a pillar on artificial intelligence as well, because we really need to have a focus there to align with our customers' focus areas. So let's first start with next-gen data center. So this is primarily about helping customers adopt more of a cloud operating model, leveraging hybrid cloud infrastructure and tying that back on premises. This is really, and to tie that, it's really about helping customers better manage their data, and which can tie into artificial intelligence, but we'll get there later. So from a data perspective, we need to make sure that they can properly access it, protect it, secure it, and also make sure in the event of some sort of ransomware attack, they can recover. So tell me a little bit about how our next-gen data center portfolio has impacted you and how you plan to leverage these technologies to help our healthcare organizations we work with.
Yeah, first, let me say, I love the conceptual foundation of our 6 pillars. It really provides a great focus on some of the solutions that EchoStor can provide. As you said, one of them is the next-gen data center. Modern data center technology and IT infrastructure are really fundamental to delivering high quality and efficient and secure healthcare services in today's digital age. In healthcare, core infrastructure provides the backbone, really, for storing and managing and accessing vast amounts of patient data securely and efficiently. Advanced data centers these days, they really need to ensure high availability, reliability, really with no downtime, that ensures healthcare providers have constant access to critical information. And they need to be cloud ready, like you said. And many of the healthcare organizations, including the past 2 that I worked at, were hybrid cloud environments. Being able to seamlessly integrate and manage core infrastructure platforms wherever those resources live is really key in this day and age. One of the things I really enjoy is working on solutions with all sorts of people at our customers, where engineers, area leaders, and mid-managers up to the C-level, because I've walked in all those shoes in my career. I've lived through and worked through a lot of the technical challenges that make healthcare unique and special. And in healthcare environments, as I mentioned, there's a wide array of systems in use. It's a highly regulated industry, which just adds an extra layer of complexity. It's constantly at an elevated risk of security threats. And when technology services are degraded or down, lives are literally on the line. And that's why reliable, fast, and secure data center infrastructure platforms are so important. EchoStor's strong partnerships with industry-leading modern data center technology providers like Dell, Nutanix, Rubrik, Pure, NetApp, Cisco, Commvault, and just to name a few. And the solutions and engineering teams we have here at EchoStor, they provide many of their healthcare companies with modern data center solutions that are high performing, highly available, and scalable to meet the needs of their customers and the patients.
Yeah, you mentioned security. That is a major focus area for healthcare organizations. They are constantly under attack or under the threat to an attack. That's been so that's been a major focus area of ours as well, in helping customers build a better cyber resiliency strategy. So again, being able to protect that data, secure that data, and recover that data appropriately and very quickly. So so tell me about some of the things that are unique to healthcare as it relates to building a more robust security model and really helping to enable a zero trust framework.
Yeah, obviously data security is a tremendous challenge, if not the most important challenge for healthcare IT leaders today. Anyone who listens to the news or works in healthcare IT knows the criticality of data security and data protection, with there being constant, almost daily reports of breaches and cyber attacks against healthcare organizations. With the increased adoption of public cloud and hybrid cloud models, it's a different architecture with different tools, different management capabilities, different connectivity options than you'd find in your traditional data center. And securing that cloud environment can be complex. It's important that the foundation of really the best security model, the best approach is adoption of zero trust. Zero trust architecture, things like using least privileged access, constant verification of authorizations, securing applications and data and all those different workloads, along with threat detection and mitigation is really key. EchoStor's experts have worked with our customers wherever they are in their cloud maturity journey. We've helped healthcare customers implement solutions with platforms from strong technology partners like Palo Alto, Cisco, Zscaler, Wiz, Vast, Sierra, Abnormal, CrowdStrike, and more. We have a broad range of expertise in these products and solutions that really meet even the most complex security and compliance needs.
Yeah. So as far as accessing some of this data and accessing some of this equipment within a hospital, networking is also a critical component. And anytime if there's a disruption in communication, it's always on the network. Everyone blames the network. So tell me a little bit about how network architecture is so critical within a healthcare organization.
Yeah, it's funny if you ask my former colleagues who worked in the network area, it's never the network until it is. The obvious network is arguably the most critical component of any company's technical environment, but it's really especially critical in healthcare environments. Medical grade networks demand the highest level of reliability, performance, and security. And there's so many aspects to today's modern day networks and healthcare environment. And there's with that topology, there's the hospital networks, there's extended networks for outpatient facilities. There's networks for hosting specialty equipment for things like radiology, cardiology labs, and wearables, and those patient care devices that I mentioned earlier. There's demand for mobility, interactive patient care everywhere. Again, there's physicians that roam between rounding in hospitals and going back to offices in medical office buildings or at home. There's a growth in telehealth and remote patient monitoring, again, expanding into wearables that are either always on or connect to the network from time to time. And so working with our partners like Cisco, Brocade, Dell, Arista, and Fortinet, our growing networking practice has been helping healthcare companies really keep up with the demands for the most critical and complex network services.
So earlier you mentioned process and improving on process within a healthcare organization. And a big piece of that is really around RPA, robotic process automation, and service management and those types of things, which kind of ties into our digital workflows pillar. Tell me a little bit about how, or elaborate on how improving on process and process automation has helped you in the past and is why it's so critical to healthcare organizations.
As Jamas mentioned earlier, healthcare IT professionals always seem to be asked to be doing more with less. There never seems to be enough money in the budget, never enough people to do the work or hours in the day to get everything they want and need to do to get it done. And that's where EchoStor's digital workflow solutions can help. It is really the most popular foundation for our clients, is whether it's in healthcare, life sciences or not, as far as their digital workflow journeys go. By implementing services like automated ticket creation, categorization, prioritization, and automated assignments. They allow for minimal system downtime, faster responses to outages, lower time to recovery, and really workforce optimization. The use cases for process management and digital workflows really follow suit in different areas into customer service, human resources, invoicing, IT operation management, and many more. And as many people know, ServiceNow is one of the industry leaders in this area. And by introducing a strong digital workflow like ServiceNow and for service request management and other IT operations like work management, asset management, documentation, that can really make healthcare IT organizations more efficient. By enabling self-service and through the use of self-help AI chatbots, self-service portals, that all helps with deterring tickets and puts more hours back in the IT resources team. Using things like pre-built or custom workflows, you can create tickets with the information collected, and that can streamline things like approvals, notifications, and ticket and task assignment. Easy access to request and update status and documentation really help the IT staff operate more efficiently. It results in less time searching for that information. Expanding ITSM with asset and inventory management really streamlines things like equipment requests and purchases, and makes auditing and compliance reporting less manual labor intensive. By integrating ITSM and service management with monitoring tools, you can trigger a workflow in ServiceNow. You can trigger that from sources like EMRs and other data aggregation platforms like Splunk, and that can result in the automation of management tests like provisioning and deprovisioning of VMs, using things like Ansible Tower. And those are just examples of a bit of the art of the possible, because you can do pretty much anything. And that's where working with a trusted partner like EchoStor is important. Our team will work with our customers, steer them to the best practice direction for the classic decision of, do I build this from scratch and take on the technical debt, or do I use out-of-the-box methods that are used and trusted in the industry? We can help you navigate those decisions and workflows throughout a digital workflow engagement.
Great. Yeah, I completely agree with all of that. You mentioned efficiency earlier and improving efficiencies through some of this process automation, and that kind of ties into user productivity as well, and making sure that doctors and nurses and other clinicians have very fast access to the data and the applications that they need to actually perform their job. Our society is ever evolving. As consumers, we're used to having everything at our fingertips, instant access, instant gratification to all of the applications or data or just about everything just through our smartphone. And the same thing is tying into healthcare as well, just to help improve on overall efficiencies. We have the patient loads are always increasing, and it can be very difficult to manage that. We have to have folks that are very efficient with how they actually conduct their job. And so we've tied that into our modern workplace practice, and really about leveraging the Microsoft services available within M365 to help empower customers to provide those services for their end users. So if you could get into a little bit how that has impacted healthcare overall, and perhaps how you've solved some of those challenges.
Yeah, as you mentioned, with modern workplace, we're mostly talking about the Microsoft 365 suite and the related platforms. You think about email, SharePoint, and Teams for collaboration and communications, and the ancillary security platforms with Entra ID, Intune, Defender, and Purview. You can augment that with adding in Power Automate, and you can really leverage the power of automating routine tasks and workflows that within the 365 environment. Whether our customers are looking for getting help of implementing Entra ID for access management, or solidifying their security with Defender and Intune, or modernizing or migrating their intranet or collaboration suites, and resulting in things like improving their visibility, compliance and auditing, reporting using Purview. EchoStor has an amazing group of technical engineers who have worked with healthcare customers to leverage their Microsoft platform investments to their full potential.
Absolutely. So then finally getting into probably the hottest topic of conversation, not just in healthcare, but across the entire globe, is artificial intelligence. That is the buzz on the street these days. Everyone is looking for guidance about how they can improve operations, provide better insight, all through AI. So tell us a little bit about how this is impacting healthcare and hospital organizations.
AI has so many applications in healthcare, and there's real efficiencies to be gained and positive operational and patient benefiting impacts that can be realized. For example, using it in clinical decision supports or for advanced diagnostics and personalized treatment plans, getting greater efficiency and reduce errors for providers in administrative areas like billing, patient outreach, using personalized communications and getting patient feedback. We're hearing more and more about virtual assistants and chatbots. It's really transformative stuff, and it's coming fast to healthcare. And the fuel that provides the rocket, the fuel that powers the rocket, so to speak, is data. And healthcare accounts for more data worldwide than any other area. And in the context of AI, it's really important to have data that's not only accessible, but high performance, protective, secured, and well governed. EchoStor is an AI practice. We're partnered with some of the major tech companies in the space like NVIDIA, Vast, as well as some of the ones we mentioned previously like Dell, Pure, Nutanix, and NetApp, as well as Microsoft and AWS for cloud hyperscalers. And we can help customers wherever they are in their AI evolution, whether it's planning, preparing, or continuing to mature and grow and keep up with demand for their customers that have for our customers that have an established AI program.
Yeah. Mike, it's been such a pleasure speaking with you today, and I'm excited to get you involved with more of our healthcare organizations and more of our customer base overall. The experience that you have, the skill sets, your technical depth is outstanding. And again, we're very excited to get you in front of more of our customers, and also excited to get this healthcare series underway. So before we wrap up, though, if you could quickly summarize some of the most important factors that drove you to joining EchoStor in the first place.
Yeah, if you can't tell, I'm just really excited to be part of the EchoStor team. The whole organization, from our account management and pre-sales advisory teams to our professional services engineers and everybody who support us, is just incredible. I can honestly say this is the most comprehensively great end-to-end technology services I've been around in all my time working in technology, and I'm just really happy to be part of it. And I'm, like you said, I'm excited to work with all our customers, especially those who work in the healthcare and life sciences industry, and lend my expertise and experience to help them solve technology challenges and improve the lives of my colleagues in IT and the patients and organizations they provide services to.
Yeah, that's great. And also, so Jamas, I know you've been a little more quiet on this particular discussion, but is there anything you'd like to say before we wrap up?
No, we're excited to have Mike on board. I mentioned we're building out the team, so a lot of excitement around healthcare. We've got incredible customers, and I think that's the key to it. And our goal is to bring a lot of these customers together, right, through networking events, different webinars. So continue to be on the lookout for more content from us within the healthcare space. And yeah, we'll introduce everybody to Tanner at some point as well. And as we continue to build the team, Maddie, and all the way up to our CEO, MJ, I know that healthcare is super important to everyone. So I appreciate the support and the support in each supporting our customers. So thank you.
I love it. Yeah, thank you both for the time this morning, and we'll look forward to the next webinar.